Chairman and member of the subcommittee. My name is Austin Lowe's, Chairman of the Sault Ste. Marie Tribe of Chippewa Indians in Michigan's Upper Peninsula. My tribe serves over 50,000 members with over 16,000 in our 7-county service area. We administer 23 governmental divisions with more than 75 programs. We steward over 4,000 acres of trust land and exercise treaty reserve rights to hunt, fish, and gather throughout our ceded territory. We operate 8 health clinics providing comprehensive, culturally grounded services, and this includes community and behavioral health, medical, pharmacy, optical, dental, and traditional medicine. As a social worker who has served in multiple tribal communities, I know firsthand how critical it is to invest in qualified professionals who support our children and our families. These investments strengthen Indian country for generations. While we appreciate the subcommittee's efforts to preserve BIA social service funding, current levels remain far below what's needed. BIA funding must cover children's services, elder services, general welfare, and burial assistance. Although nominal funding has increased about 23% over the past decade, inflation and population growth have erased those gains. Tribes now operate essential programs such as child welfare protection, welfare assistance, and housing repair with effectively less real funding than we had 10 years ago. And the consequences are absolutely clear. A 2020 KC Family Study found that Native American children represent 15% of children in care nationwide, despite only being 3% of the total U.S. population. At the same time, major investments have been made in BIA criminal justice programs. While public safety is absolutely essential, we must invest equally in social services, the systems that teach parenting skills, help families manage stress, and strengthen cultural identity. Without this balance, the criminal justice system will remain overburdened and unable to support healthy families. Protecting our treaty territory is also central to our people's well-being. The Sioux Tribe accounts for roughly half of all commercial treaty fishing and the majority of subsistence harvest in the 1836 treaty ceded territory. Because of this, we request that funding for our Natural Resource Division reflect this. Our tribal court, which is an essential expression of our sovereignty, is also severely underfunded. Federal support covers only 3.76% of our base need, and funding has increased by less than $3,500 over the last 21 years. We urge Congress to fully fund tribal court-based budgets consistent with the BIA's own model. We also operate the JKL Bawating Anishinaabe School, which is a K-8 BIE-funded school that provides both culture and academic excellence. Yet BIE operational funding has remained stagnant despite rising costs for salaries, insurance, transportation, and food. Investing in Native schools is one of the most impactful choices that Congress can make. I'd now like to change gears towards substance abuse. As this subcommittee knows, substance abuse and mental health conditions pose one of the greatest threats to our future. According to the 2021 National Survey on Drug Use and Health, nearly 35% of American Indians and Alaskan Natives experienced either mental illness or a substance abuse disorder. Meanwhile, access to inpatient treatment remains extremely limited. Better coordination among the BIA, IHS, and DOJ consistent with the Tribal Law and Order Act is absolutely essential. We urge the subcommittee to direct these agencies to report on their efforts to coordinate and improve programs related to public safety, justice, and behavioral health in Indian country. Miigwech for the opportunity to present my testimony today. Thank you.
Thank you. Winnay.